Biik chetinye HIV and AIDS komatinye immunity nemiten barak, ak kounoton komuche kosich COVID-19 en kasarta neng'ering. Kosubkei ak niton, ko kakituye ak Dorothy Onyango neboisie en kibagengeitab kwonyik nenaat ko Women Fighting AIDS in Kenya.
Okay, my name is Dorothy Onyango. I work for Women Fighting AIDS in Kenya as the Executive Director, but I'm also one of the founding members of WOFAC. WOFAC was started as a result of a few women who came together who were already infected with HIV, and we saw need to support one another. So it started as a social group many years. That was in 1993. So in 1994 we decided to formalize the organization, and it was registered in 1994. And our main aim for this was to see that we are able to support, empower women infected and affected by HIV, also to care for children infected by HIV from their mothers who are already infected by HIV, and of course give information on HIV and how to protect ourselves, and how we can move on with our life positively, considering that we are already infected with HIV. So that is how WOFAC started. Yeah, and of course we had to, our target group mainly was youth, young people living with HIV, because that time, there were those who were already born with HIV, but we had nothing that we could do. So we were just, like a social group that we could come, have group meetings, and just console one another on how best we can take care of our children, our spouses, and of course friends around us. We are in 11 counties in Kenya, and these are counties that at that particular time had high prevalence of HIV, which they still have. So that is how we decided. We chose those regions that we are working with. Initially it was provinces, but now they are counties. So we are in Mombasa, we are in Kwale, we are in Kilifi, we are in Homa Bay, Kisumu, Busia, Nairobi. In Nairobi we have this office. We also have Kariobangi, and we have Kayole offices. Yes, but we also work with the health facilities, and we have placed our counselors at the health facility to help our members that go to the clinic, and of course the general public, of those who live with HIV, who feel stigmatized. So this is a safe space for them where they can be referred to the doctors or the clinicians, but the first place they go to is a desk where WOFAC has counselors, qualified counselors, who take care of them and support them.
Kosubkei ak nendet, en kasari komaityin biik walutik chetinyegei ak HIV and AIDS, ak kounoton koraisi kokokwa barak koimutikab HIV and AIDS.
Right now people are not even going to the facilities. The members are not coming often as they used to come to us. So definitely if there is lack of information, it means definitely there are more infections that are happening, especially for youths, and now that the school is closed. So that is our biggest worry. How do we ensure that they get information, and yet we are not able to even go outside there to see them or communicate. And some of them live in the rural areas, so they don't have that advantage of being able to participate in our forums through virtual meetings, because of bundles, because of the network, so yeah, it becomes really difficult. So it means that there are more people who are being affected by HIV during this COVID period.
Kokomuch icheket kokoito amitwogik ak PPEs kobun kibagengeisiek cheboisie ak icheket kou AMREF.
The information that gets to our members will not be 100%, but we are working with development partners like UNAIDS, AMREF, Red Cross, to see how we can reach our people. Right now, what is very important is food, because when you are on medication, you need to take food. So AMREF has been able to support us with PPE kits, especially in the areas that they are working with us. Red Cross is actually giving food across board. So we identify our members, and of course they reach to the members, but they are not able to reach to all the members that we have. They have also given us food, and we have identified the members that we are giving, but they are still doing mobilization of how to get more food so that it can reach everybody that requires, because especially for people living with HIV, because we know that where they are giving food, especially, like it goes through either the chief's office, but you have to give a reason why you think you are vulnerable. And for us, we think this is really stigmatizing, because somebody will not go out there and say, I'm HIV positive, that's why I should be given food. Sometimes probably you have not disclosed to your family, to your close people, and therefore that means that there is no confidentiality. So that is why we are looking as WOFAC to look at other resources, how we can work with other donors so that we are able to reach our members, to get food so that they don't miss their medication, because they cannot take their medication on an empty stomach. Then for those who are not able to get to the facility, there's community health volunteers that we work with. We have also supported them with fares and PPE equipment, which is mostly sanitizer, the masks, so that they can go and visit people at home who cannot go to the hospital. They follow up on children who are infected and have not taken their medication, and where appropriate, they can actually go to the hospital and pick on their behalf or accompany them to go and get that. But even the CHVs themselves are, scared of getting COVID-19. The other thing is that as WOFAC, we have been empowering women and giving them income-generating activity. Like the agricultural products, they make kitchen gardens. Some go to sell things in the markets. All this they have lost. So they're actually depending on us, and we are trying to look at how, now that the lockdown is lifted, how do we again support them with agricultural inputs so that they can actually work on their kitchen gardens. Those who are doing businesses, because whatever they had, they've already depleted. They have used every money, they have used what they were selling. So we are trying to see with the development partners, especially UNAIDS, how do we start again helping them to get back to their kitchen gardens, because giving food is not sustainable. We can only give that for sometimes 3 months, 4 months, but we cannot be able to sustain that. So we want them to be independent and be able to come up with their own food that will help them with their families.
Agot kounoton, kobune icheget kaimutik cheterter, misingo en kasari ba COVID-19.
The other challenge is that when you go to get the food and it is crowded and already as a person living with HIV, your immune system is already compromised. So there is that fear that you will be able to get COVID. It is not proven, but of course people living with HIV have already a compromised immune system. And if you are not taking your medication regularly, especially this time of COVID, and because you don't have food, so it is actually a risk for you to go to the chief's camp or wherever food is being distributed. Although we have not gotten quite enough to distribute, because our membership is like 10,000 members. So they get them also from different places, but where we can, we have already been able to provide. Like I mentioned to you, like the Red Cross and AMREF, they give us specifically for the projects that they have with us. And this means that it is for the membership, including our staff. But for those who are not within the projects, then it becomes a challenge. That is where we have to work even harder to ensure that we get more PPEs. We are continuing writing proposals. We are also requesting for this development partners to see how we can be able to see that we give to everybody that needs, especially our membership.
Kanda tokosiche kerichekab ARVs, kokamwa Dorothy kole motinye kerichek che naat ko Septrin che magat kolugui biik chetinye HIV and AIDS.
What was missing, which I don't think they have replenished again, is the Septrin, which also you take with ARVs, especially as a prophylaxis to protect you from getting the either chest infections. But most of the comprehensive care clinics have been able to give the clients 6 months dose of medication. I picked my 6 months, so unless I have a complication is when I have to go to the clinic. But most of the clinics have been able to give clients medication for 6 months. Where I get my medication, I don't think there is a problem, unless it is just the problem of transportation from KEMSA, or probably the health facility has not requested. But in terms of ARVs, right now we have ARVs.
Kates kole magatan serikali kotoret biik chetinye HIV and AIDS kamun imuche kosich biik chechang HIV and AIDS.
There is a need to step up, because so far the support we have gotten is from development partners. We have not received any support from the government. No. As it is right now, we are already suffering that funding, because everybody is looking at COVID. So most of the funding is actually being taken to COVID. And even the programs that we are running with donors, they are asking you to allocate certain amount to COVID, because as you cannot go out to implement activities that you already planned for, so that money goes to activities to support COVID. So it means that after COVID, then we really have to look at how do we fill in the gap that we already have because of the monies that went to COVID. Because definitely if we have activities that we had planned to carry out in the year, it means that once we are able to go out again, we will need to continue doing those activities. So it means that we have to look for more money, and that money is not there. And of course, COVID will come with its after effects, that it has caused to the world, and of course to our members living with HIV. So definitely we are worried. Some people will close shop because we don't have funding, but even us at WOFAC, we are struggling to see that we get funds. Because even at office, we are not working full capacity. In the field, they are not working full capacity, but people have to be paid, because this is the time that they actually need that money to look for food, to, like the masks. It's an extra cost for members, like the sanitizer is an extra cost for members. At the same time, you have to continue buying your food, and it's not like you will get an extra amount of money to actually buy the mask and buy the sanitizer, and the soap. So, of course, we have given soap, we have given jig through UNAID support, and food from Red Cross. But we still need more. But definitely our programs will be affected because of COVID.
Agot kounoton, kokacher biik chetinye HIV and AIDS koribke mat kosich COVID-19.
They need to follow the guidelines that have been put up by the government to make sure that they have masks, they are washing their hands, and get off crowded places so that they are not caught up in such situations. And of course, we are continuing giving them information to advise them on how we want them to take care of themselves. We don't have a hotline number, but we work with our branches. So every member who, for instance, who is in Homa Bay knows that if I want to get support, I will work with the office in Homa Bay. And of course, we have trained quite a number of community health volunteers who also give them information on our behalf. We have a website, and we also have a newsletter that is bi-weekly that we also send out. But if somebody wants to support us, they can always reach us through our numbers in our office. We have our brochures, but of course the one that they can get easily right now is on our website. As people living with HIV, the struggle continues. So we know better where it bites us, but we are not going anywhere. We are here to struggle. We are here to support our members, and life must continue. We'll continue living positively, because it has been a long journey for us, people living with HIV. So, and especially for women who, you're the mother, you're the caregiver, you're the one who's supposed to get the food for people. So we're just encouraging them that they continue supporting the communities the way they have done. And that is the only way that we can be able to protect our people from getting hurt from this COVID pandemic.